We know that there's been a lot of confusion, there's been a lot of misinformation about vaccinations. In fact, here in the United States, it also became very politicized. What are you seeing, and what are parents telling you?
Anand, I'm seeing exactly what you've just described. As parents out there all unifying in the fact that they want to do the best they can to protect their children, but they've heard mixed messaging, not only about the vaccine's effectiveness, but whether or not the children actually need the vaccine if COVID is actually causing severe illness, either acutely or long-term in kids. Then there's also a whole sea of misinformation out there about potential dangers of the vaccine, such as the vaccine affecting puberty or growth in some fashion, or altering DNA, which we know none of that is true. And I think what this does show us is that we really stumbled when it came to quick scientific communication, but also being able to put out information fast enough to combat misinformation. That number you cited of 30% of kids age 5 to 11 actually being fully vaccinated, that number is even lower for kids below 5. And the one thing that I will tell everyone out there, both as a journalist and still as a pediatric hospitalist, someone who sees kids every day hospitalized, not only with COVID-19, but with a whole sea of diseases, is that children should not be pushed aside and saying just because children are not elderly or don't have serious chronic underlying conditions, they cannot get sick. And that was a narrative that was pushed forward against vaccine hesitant populations for the past year and a half, 2 years. And so any parents out there listening, if your kids are not vaccinated, please do so. Get them their COVID-19 vaccine. Also get them their flu shot. I'm going to plug that as well because we're heading into cold and flu season.
That stumble that you talked about, Alok, when this became very politicized and there was a lot of misinformation around, what's being done to counter that?
I think one of the most important things being done to counter that is acknowledging it. First of all, we saw CDC Director Walensky put out the results of her finding and saying that the CDC and other national public health entities were not putting out information quick enough. We saw preprint studies get headlines in a way they never have before in the history of scientific publication. There has to be a new method moving forward to actually come forward and say, right, this is not true, this is true. We got to get information out there faster. And one thing that's really important is to make sure that we're speaking to people in terms they understand. This is where community leaders are so important. Yeah. And we need to make sure that as public health and scientific communicators, we're not assuming that everyone out there is watching television, reading scientific journals, has social media, or knows exactly where to find the right information at the right time. We need to meet them where they are.